Hi everyone, I'm Dakota.
I'm Maya, and we are pathology residents who want to teach patients how pathologists are involved in their care and what different medical conditions look like under the microscope.
In this video, we'll be talking about what Crohn's disease looks like under the microscope. So here we have a normal piece of colon. From the bottom of the screen to the top of the screen, we have the muscular layer, the submucosal layer, and the mucosal layer, which is the inner surface of the large bowel. If we look in the mucosal layer, you can see these structures called crypts, which can look like either a field of daisies or like test tubes, depending on which way they're cut. Notice how the crypts are distributed very evenly throughout the mucosa. That's how a normal colon should look. Now let's compare that to a piece of colon with Crohn's disease. We still have the same layers, although they do look a bit different here. If we take a closer look at the mucosal layer, you can see that the crypts are still present in some areas, but they are much more spaced out and are surrounded by a lot more blue, which are inflammatory cells. Now, if we zoom out, we can see that in other parts of the mucosa, we have completely lost the crypts, which is known as crypt dropout, an important feature of Crohn's disease. We can also see these circular white areas known as granulomas, which go further down into the submucosa and muscular layer. Granulomas are a hallmark finding of Crohn's disease. If we zoom in further on one of these granulomas, we can find one of these funny looking cells, which are called multinucleated giant cells, which are essentially macrophages that have gobbled up dying cells and debris. Putting all of these findings together, along with the right clinical picture, equals a diagnosis of Crohn's disease. Let us know in the comments what conditions you want us to cover next.